Hi, welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon, working with Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is equipped with all equipments like laser machines, coabulator machines, microdebrider machines, endoscopic units and microscopes. All these will help in accurate treatment surgery for the ENT problems. Nosebleeds sometimes occur in all ages. Many of them we have at least one episode during our lifetime. These nosebleeds mainly it will come anteriorly, rarely posteriorly also, but mostly anteriorly. It occurs in children, middle age and old age people also. Children and old age people, these are serious issues. Middle aged most of the times, except tumors, it is not serious. In children, because even little bit blood loss also, because they have the total body blood is less. If even 100 ml to 200 ml blood loss due to nosebleeds may cause the patient hypovolemia and other systemic problems. When children has recurrent nosebleed, always get examination with nasal endoscopy and coagulation profile blood test. Rarely in coagulation blood profile test, there is a platelet less or another coagulation problems which may lead to the bleeding. We have to correct that. But local problems due to deviated nasal septum, hyper or congested area in the littles area, telangiectatic blood vessels in the nasal mucosa, septal mucosa will cause the recurrent bleeds. If children has recurrent bleed regularly, we have to see that bleeding point at the time of bleed and cauterize it. And if there are many telangiectatic blood vessels, you also cauterize. If there is associated DNS, you remove the deviated nasal septum part, induce the fibrosis in the septum, and this may reduce your bleeding. In elder people, if any bleeding occurs in the nasal septal nasal area, the bleeding continuously goes on. Basically because of hypertension, this we call it as a hypertensive bleeds. When bleed comes, patient will become tense and BP rise, again bleeding comes. Second reason is, in old age, a vascular blood vessel media will become fibrosed and the constriction is less. So, constriction is not there, then bleed continuously from that area. So, hypertensive bleeds and atrophic mucosa nasal bleeds are common in old people. Whenever old person comes with bleed, you cauterize the local area, control the BP, examine mainly for if any tumors. Middle age bleeds are less common, but sometimes happen in middle age. If the patient has recurrent bleed, always we have to do CT scan and nasal endoscopy to rule out any tumor pathology. If you have recurrent nasal bleeds, contact Asian ENT Care Center located in Panjagutta, Hyderabad.